Hi, I'm Maureen Codispodi, and I'm so happy to be here with Gordon today to talk about Help Clinic Canada and how we create safe and supportive environments for our client and our teams through cultural humility.
Well, hello everyone, and I'm really happy for you to get to know today Maureen Codispodi. Maureen is located on the west coast of Canada, so we're pretty far apart distance-wise, but we were just talking about the fact that I was up in that part of the world not too long ago and just enjoyed how beautiful it is. But Maureen, why don't you tell folks, as I start with everyone, a little bit more about yourself and how you've landed where you've landed?
I have been a professional for about 25 years now, and in my professional career, I started in community-based mental health. I moved into education, and then I moved into learning services, and now into clinical counseling and therapy. And I have had an amazing life experience. And, in the 20 years or so that I lived abroad, I've learned so much about many different cultures and what happens in the world and how cultures and communities live and work and how that impacts, individual experiences. And I always had a sort of dream to be able to work and help people in a different capacity. In 2009, I actually cycled across Canada. I'm quite the adventurer and I love a great experience. And I on that journey, I was fundraising for breast cancer and I met the most amazing people along that journey. And I had conversations with men talking about their wives, their daughters, and people just really opened up to me. And at that time, I wasn't a therapist, but those memories of those like deep personal conversations with those people really stayed with me. And just understanding, the small communities in Canada, how they're different from the big cities, and, east to west, how the landscape of Canada changes and how that really impacts people's experiences and being in little remote communities where there's limited services and that sort of thing, it really always stuck with me. And so thinking about my life and my professional career and my lived experiences overseas and that trip, this idea of Help Clinic Canada kind of came to me, and I created a space where no matter where you live in Canada, you can access mental health support with virtual therapy. And we're really proud to, create a space that's ethical as well as reducing barriers for the people trying to access it. And I just really am proud to say that, all of the things that have happened in my life, it's not been a straight road, have led me to this place to create this space for other people where they can get the support that they need. And, I'm just a very passionate helping professional, and
Yeah.
that's my life goal, right?
Well, what an adventure cycling across Canada. That must have been just, I can only imagine that it was a life-changing event for
Yeah.
you. Yeah. Yeah.
Yeah.
And my heart goes out to you for just for the breast cancer awareness. I think most of the people that listen to the podcast are aware a little bit of my story, and I don't know if you are, Maureen, but I lost my wife to breast cancer last year. And so just the understanding of the care and all of that sort of thing around that, and particularly spouses and that sort of thing, is something that's near and dear to my heart as well. So,
Yeah,
yeah,
Gordon, I didn't know that, and I'm
yeah,
so thank you for sharing that. I
yeah,
have listened to your podcast, and I'm sure you've
uh,
shared that, but I didn't
uh-huh,
hear those episodes. And
yeah,
my heart goes out to you, and you do see what I kind of saw on the
mm-hmm,
road there, and it's fascinating to me. You know, care for men and mental health is still harder for men, right? And
mm-hmm,
you would know as a practitioner, and having a space where men feel safe to share feelings
yeah,
and things like that can be really hard. And the impacts of something like that have a certain ripple effect, right? And I'm certain it
right.
probably has impacted your clients in a
Uh,
in a great way.
right, right. And I think, fortunately, I've had just tons of great support around me through the whole experience. And yeah, I don't, not to digress too much down that trail, but yeah, it's the lived experience is certainly different than the intellectual knowledge of it. So, I mean, that's just,
Mm, mhm.
yeah, very true. But yeah, so yeah, one of the things that I think is intriguing is that there's this passion that you have around making mental health services available to people that maybe have difficulty finding it or that sort of thing. And tell us more about that journey and how you put Help Clinic together and what
Yeah.
that's been like for you.
So one of the things that I realized, and obviously COVID kind of left this gift, I like to say, where people are
Hmm.
really more open to online therapy. I think that it's important to recognize that, there is limited access to many people in Canada. And I'm sure that it's similar in the US where you have small communities in the middle of nowhere, and even if you do have access to extended health benefits or the funds to pay for the therapy, you may not have anyone that can support you in your community. And if you do, that might be your neighbor or your friend. And so creating a space where people can go and have autonomy and agency over their choice of therapists and creating spaces where it's easily accessible is really important. Also, the landscape of sort of costs of therapy across Canada differ depending on like urban and rural. And so we have sort of created a fee structure that it reduced the costs slightly for people that pay full fees, and most of those fees go into our independent contractors' pocket. So our take home from our company is very little. So it's reducing barriers in that it creates opportunity for more therapy for people with their extended health benefits. And then in the fall, so in a few short weeks, we're launching our low fee counseling, which is really the
Wow.
passion project of mine. And so we have amazing practicum students starting who are going to be taking on clients for low fees across Canada. And so that is going to be able to reduce so many barriers for so many people and enable so many people to get access to therapy that wouldn't otherwise have it. The structure of, mental health support in Canada certainly is, if you have a job or you have a situation where you have extended health benefits, it's great. You still may have limited access. And then if you don't have the access or you don't have the funds to pay out of pocket, it's really difficult to get mental health support. And so trying to create a social enterprise that supports and breaks down those barriers is really the crux of the company. And so we have kind of both, the full fee and the low fee, and just making sure that we're really conscious in creating ethical pricing for everybody.
Right, right. How I'm curious, how do you determine, I guess, which clients fit into which fee structure and all of that sort of thing?
That's a great question. The full fee counseling, is definitely for people that have extended health benefits. And then the low fee structure, there's an application form and it asks some very simple questions like, do you have extended health benefits? Can you afford therapy? And people are able to self-disclose that information, and we
Hmm.
take it on an honor system. And then we're able to match those people that don't have the benefits or have the means with the low fee program. And otherwise, it's really just on an honor system. But I think that most people are honest about these things. And we do charge a minimal fee, but I think that just ensures continuity of care and ensures that the therapists that are working with the clients also get their needs met in terms of their education and having clients. But our intention is that the low fee clients can have ongoing care and that we won't cut off sort of at 6 sessions or something like that. And so,
Hmm.
we internally, review all of the applications and try to make best matches with our practicum students as well as our full fee counselors, depending. And then our full fee counselors have all agreed to take on at least one low fee client. And so some maybe more complex cases or cases that need a little bit more experience, we'll match those with our experienced and licensed therapists.
Yes, yes. And I think, yeah, one of the things maybe just to mention is that for folks that aren't necessarily familiar with the healthcare system in Canada, it's a good bit different than it is here in the States, and that you've got, and you correct me if I'm explaining this wrong, you've got universal health care, and then people can opt in to get kind of like additional services if they choose to. Is that correct?
So we have universal healthcare that covers like basic healthcare needs, and then every province would have differences in terms of what's covered in terms of accessing public healthcare. So in the terms of mental health, it's very difficult to access publicly funded mental health care, especially therapy. Those would probably be more extreme cases of mental health or different reasons for those mental health care needs. But it's viewed as sort of that sick model. So anybody that's trying to be proactive or has, some general anxiety or, just wants to get some support with their mental health, you would have to have extended health benefits or pay out of pocket to be able to access therapy in general. Some provinces are starting to create programs that do cover therapy, but this is very, very beginning stages. And so
Mm-hmm.
we're all hopeful that things will change in the landscape of mental health in Canada, certainly.
Mm-hmm.
But it is a gap in our country, and while we do have amazing or publicly funded healthcare, there's lack of access to services. There's many communities that people don't even have doctors. There's a shortage of support in general for health in Canada. So
Mm-hmm.
it's not a perfect landscape, but it definitely, it's nice to be able to be in a country where, everyone has access to go to the doctors when they need to or
Mm-hmm.
should they need to.
Yeah.
It's really, we're very fortunate for that for sure.
Yeah. Yes, definitely. Well, as far as that goes. Yeah. And so your focus is on really, it sounds like people I'm assuming that your your company is pretty much all telehealth. Is that a correct assumption that everything's done by
Correct.
telehealth? Yeah.
Yeah. Yeah.
Yeah.
And we actually utilize a platform called Jane app, and that's a Canadian-based virtual mental health platform. And so we can run sort of video sessions, we can do telephone sessions. It allows us to sort of have robust access. Well, they kind of, sorry, hopefully you
Mm-hmm.
can edit this. uh,
Yeah.
they help us to ensure that we are abiding by all the laws and all the standards. So in Canada, some of the laws are a little bit different. We have POIPA and PAPITA, which regulate how we handle information, and so Jane app
Mm-hmm.
allows us to ensure that we're using all the right systems.
Yeah, yeah. So it'd be akin to what we refer to as HIPAA here in the United States. Yeah, yeah,
Correct. Yeah. Yeah.
sure, sure. Yeah. So I'm wondering, how are people finding you? In other words, how are you marketing this to people, and what are you finding that works? Because
Yeah.
yeah, you're having to reach the whole country.
Yeah,
Uh-huh.
so we only officially launched May 6th, which is in line with Mental Health Week in Canada, and
Mm-hmm.
we are slowly gaining clients for all of our team, and most of the clients that we have already have been through word of mouth and referrals, which is kind of, how practices start, right? And
Mm-hmm.
we're only going into a phase now of sort of starting to advertise, and yeah, our intention is that we will grow with all of the
Mm-hmm.
advertising that is about to happen. But so far it's honestly just been good old-fashioned word of mouth and networking and
Mm-hmm.
putting ourselves out there as a team, and as well as me strongly advocating and getting out there in the community and being in the news and wherever I can, just getting the word
Mm-hmm.
out about our company. And that's really where we started, and our intention is to grow and to reach more people.
You're right. Right. Yeah. So are the people that the contractors that you have with you, are they, I'm assuming again, I don't want to make too many assumptions, but are they located all over Canada, or are they more
Correct.
regionally
Yeah.
correct?
No, so they're all the, sorry to interrupt you, all the independent contractors are located throughout Canada, and then different clinicians have different credentials for different provinces. There's different regulations, obviously, in terms of backgrounds and that sort of thing. Not all the provinces in Canada are regulated. So we have therapists in almost every single regulated province. The only province that we don't cover right now or territory is Quebec. And otherwise, we have therapists that are dotted around the country, and some of them hold multiple credentials for different provinces. And then for the unregulated provinces, we have qualified therapists who have credentials in
Mm-hmm.
other ways. So we only have a few colleges right now, but the province that I'm in currently, BC, is starting to the process of regulating psychotherapy in the province. So it's pretty exciting
Mm-hmm.
times.
Yeah.
And yeah, so we're all dotted around the country. And so there's a lot of time zone discussions and also, virtual meetings and conversations with people,
Mm.
and that's just how we operate.
All right. Right. What have been your biggest challenges so far with getting this going?
Yeah, some of the biggest challenges I would say is just ensuring that, team communications are seamless and creating spaces where everybody can join because many of our independent contractors have other things going on. They have, different places that they work. Some work for public schools, some work for, hospitals, some work other private practices, that sort of thing. So just
Mm.
creating spaces and time that works for everybody and creating that cohesion. But it's starting to happen and we're starting to create that really amazing supportive space for people to communicate with each other and just having internal spaces for people to connect and support each other is really important, and it just takes time to establish all of those things. I think some of the other obstacles are really just like business related obstacles, and I don't come from a business background, but I've built this company and,
Mm-hmm.
I know what skills I do have and I try to outsource all the ones that I don't, but sometimes I just have to learn how to do different things. And so I
Right.
think I sometimes have been the biggest obstacle, but also, if I don't do it, then sometimes the needle is not going to move, right? So I'm
Right.
sort of the person in the driver's seat, but, I'm starting to build a great team around me that support me with everything. And yeah, it's definitely a labor of love at this point.
Yeah, right, right. Well, it sounds like a wonderful organization. How are you recruiting your therapists and students that are working with you?
Yeah. So we originally put out a job posting in, I think, December, and we had an enormous, enormous response. And so we continue to keep recruitment open, but we only advertised, I think, for 3 days. And
Wow.
it's just ongoing and open. And so as there's like needs or specific niches, then we'll hire from that candidate pool. And then in terms of the students, we actually connected with different universities across the country to try to form relationships with the universities first so that we could support their students. We could obviously open it up, and we do have the recruitment page open for students, but we primarily focus on the universities that we have the established relationships with as a primary source. And I think that just having the support of the universities is really important, and knowing that they align and they believe in our values and our mission, I think is sort of primary for us because we do believe in creating safe and supportive learning environments for the students that we serve.
Hmm.
As I said, I come from an education background too, so I know how important learning is. And, this is one of the most important parts of our company, as I said. And yeah, I feel super passionate about creating spaces for students and, having it be a win-win for everybody sort of thing.
Right, right. Yeah. Are there how do people typically fill their caseloads? I mean, are you finding that that's a difficult thing, or is it pretty easy to fill somebody's caseload?
Yeah. So right now it's a little bit challenging. We've started out slow. So some of our therapists, are starting out with a few clients, and the best thing that works really is when the therapist and I work together to build those caseloads. I think that it's not, we're not just here to advertise for those independent contractors, but we do create the space and, create the space for them to have those clients. And so the ones that have been more successful in filling their caseloads, it's definitely been a team effort. But as we
Hmm.
grow and I think awareness comes from the company, I think that, that will tip a little bit more on our side. And because we only have just started to invest financially in advertising and that sort of thing, we'll probably see it tip to more of our responsibility, and also filling those caseloads will get much, much easier. But definitely, I think anybody that starts a private practice or a group practice, I think, it's slow and steady. And some people comment that we have so many therapists, and I think it's important to know that the company that we created, we wanted to create what we wanted it to be from the outset and not like grow into the shoes of it, but rather say, this is who we are, this is what we are. And so
Mm-hmm.
all of our therapists kind of, as I said, have many things going on. So they all know that it's sort of slow and steady. And that's,
Mm-hmm.
our intention, because we do want this space to be as it is, and we do want it to be accessible across the country.
Mm-hmm. Yes, that's I think one of the things that I've learned in my own practice. The more you can encourage your therapist to kind of build their own caseloads rather than it just all falling on the owner to
Hmm.
do that.
Yeah.
Yeah, yeah. So, how many clinicians do you have so far?
We have just over, I think we have 33 at the moment. And then in the fall, we have 11 interns starting, but four of those interns are bachelor students. They won't be clinical interns. And then the other seven practicum students will be taking on those low fee clients. So, and all in all, we'll have about 40 clinicians able to take clients at both full fee and low fee. Yeah, so it's really exciting.
What sort of challenges are you finding just managing that many people?
Just making sure that there's continuity in communications. I think also, I understand uniquely that like everybody is different. Everybody has, different ways of communicating. And as I said, we wanted to create a really diverse team. And so that diversity also includes, styles of communication and how they are as a therapist, who they are as a human being. And I think I have a lot of space for managing different personalities and ensuring that people feel that their needs are being met. And so just, I'm often able to sort of give grace to situations that, if I wanted everyone to conform to my way of thinking, wouldn't
Hmm.
maybe exist. And I really do believe in, self-efficacy and self-agency, and having therapists that have their own way of being. And so we do, we are committed to that diversity, but it can have its challenges, of course. And I
Hmm.
think, I with my, my own lived experience, I'm able to kind of manage all those personalities and all those things, but it's a work in progress for sure.
Yeah.
Yeah.
Hmm.
And as we
Yeah.
create better communication channels and strategies, I think that it will only get better. And I know that, people that have joined us are committed to kind of our mission and vision, and they
Hmm.
really want to see us grow. So yeah, I think that's the one unifying thing for most of our therapists, is that we all have the same belief and creating these
Yeah.
barrier-free places, right? So
Right. Right. Yeah. Yeah. I think when you, particularly if you're using what I refer to as a contractor model of running a business, you really do need to make sure that you hire people that are self-motivated and are bought into what you're doing because you've got less control over what they do and how they do it. So I mean, it's just yeah,
exactly. Yeah.
yeah,
That's a really good
yeah,
point.
yeah. Well, Maureen, I've got to be respectful of your time. What sort of parting thoughts might you have about all of this?
Mm. Yeah, it's really, thank you for having me, Gordon. And I
Mm-hmm.
think, really what I want to say is that, it's never going to be perfect in creating a business. It's never going to be perfect in creating spaces. I'm never going to get it perfectly right. And I'm okay with that. I'm okay with being imperfect and going for it anyways, because I truly do believe in the, mission and vision of the company. And I really believe in creating those safe spaces for everybody and reducing those barriers. And I encourage other people to, take the risk, do it anyways, do the thing that you believe in, even when it
Mm-hmm.
feels a little bit hard. Because trust
Right.
me, some days it feels hard,
Yeah.
but
Yeah.
I believe. Yeah.
Yes. Well, tell folks how they can get in touch with you and maybe find out more about your work.
Yeah. So our website is HELPCA, so helpclinic.ca. And you're very welcome to go on there. You can find our contact details on our website.
Awesome. And we'll have a link in the show notes and the show summary so people can find that easily. Well, Maureen, I'm so glad that you joined me on this episode, and hopefully we'll have a conversation again here in the near future.